Lymphadenopathy is a very common clinical problem in South Africa, the more so because we are at the epicenter of the HIV epidemic, and also because TB is endemic in much of our region. In the Western Cape, we have started an initiative to try and address this problem. I'm a hematologist, and although cancer is a national health priority, we find that patients with lymphoma get diagnosed very late. They are missed because of the insidious symptomatology, and also because TB, HIV, and lymphoma are great mimics of each other. So here at Groote Schuur Hospital, we made a plan to address this. And we had to ask some questions to ourselves. Firstly, we saw that fine needle aspirate is often used on lymphadenopathy as a rule-out test for cancer. And we had to say, but it is not a rule-out test for cancer. Tissue is what you need if you want to make a good lymphoma diagnosis. And what about implementing a tool that is actually used widely all over the world, namely core needle biopsy, and take it to the clinics, take it to the public out there so that people can have access to diagnostic procedures up front. We spoke to doctors in our region, and we wanted to address this catch-22 of, I cannot make a diagnosis in my patient because I don't have the tools, but I can't refer my patient because I do not have a diagnosis. So that's a quandary that we try to address by getting effective TB diagnosis on the one hand, as well as effective histological diagnosis on the other hand. So it's a two-pronged approach, and the first one is a directed fine needle aspirate with expert test for making an accurate diagnosis of tuberculosis. And the second part of the investigation is using a core needle biopsy gun with or without ultrasound to get a good biopsy of lymph nodes that are at least 2 centimeters or more. So our vision is to educate healthcare workers and empower them with best care practice for early and accurate diagnosis and treatment of lymphoma versus tuberculosis versus cancer. And this pathway implementation is to translate this problem, this clinical problem, into a best care pathway where we can effectively diagnose lymphadenopathy or lymph node masses. We call this vision a rapid access diagnostic lymphadenopathy clinic. So the plan is to bring the required tools right to where the patient is and to where the healthcare worker is. It will be rolled out as a diagnostic pathway for effective diagnosis of TB versus lymphoma versus cancer of the lymph node.